Hello, my name is Dimitrios Moutzouris, and I'm a kidney consultant at Guy's St Thomas's NHS Foundation Trust in London. I'm also a senior lecturer at King's College in London. In the next 10 or 15 minutes or so, I'm going to talk about home monitoring of renal transplant recipients. When we talk about home monitoring for renal transplant recipients, we include 4 different pillars. That includes the home finger prick blood test, and this is going to be the main focus of this presentation. I hope in the future we'll have the time to go through the other pillars. I will mention them. For now, I'll just mention them. So we do home urine test, which is, I think, a well-established service in many transplant centers. We also use Bluetooth-enabled devices for blood pressure and weight monitoring, and also remote consultations, which is a common practice throughout the world during the pandemic. So the main focus of today's presentation will be the home finger prick blood test for renal transplant recipients. As we all know, transplant recipients, they need frequent blood tests, and that includes immunosuppression levels. And that means that we have to do the blood test in theory 12 hours after the last dose of the medication. In reality, this is very challenging. The clinics are busy, and that was a main issue during the COVID-19 pandemic, where we're trying to keep these vulnerable patients at home. At the same time, we didn't want to take any risk or compromise the quality of the care. So at Guy's, we use different approaches, different devices, in order to try to see which one will offer the best quality and the best service for our recipients. This is a growing field, and there are many, many devices. Almost every other month, there is a new device that promises something innovative. We explore quite a few devices at Guy's. We end up using a couple of those. I need to clarify, I have no relationship, no shares, or no funding from any of those companies. Again, just to show that in the market, there are many, many devices. So in this video, I'm just sharing with you the pack that we sent to our patients in order to have the blood sample collection at home. So this pack contains everything they need, including a device that is called Mitra device, a patient's information sheet, a form, a lancet, and also a pack that they can return it back to the hospital. The process is very simple. It's similar with checking your blood sugar at home, and it allows the blood sample collection in a standard way. I just going to forward the video just to save some time. So very simple. We just need a couple of blood drops, and then this device absorbs the blood, it stabilizes it, and then the whole pack, along with the patient form, is being returned to the hospital. Yeah, so at the end, we ask the patient just to take the device, to put it in the bag and return to the hospital. So before we start using this device, we validate the device in 2 different ways. First, by using the devices in real time, patients by comparing the results taken from this device versus the standard of care, the liquid blood sample taken in the hospital. And then we asked our patients to, when they were coming for the standard visits, to do also a blood sample collection themselves. This is the results in regards to the creatinine. There's a tiny variation between the results that we take by the standardized liquid sample method and the results we take by using the Mitra device. With sacroilimus, the results were similar, as you can see. And so we've validated that in more than 150 patients before starting using them as a regular service in December 2020. Again, the main conclusion from this validation study, which was run in 2 phases, was that there was no significant error between the laboratory and the Mitra finger prick sacroilimus levels. And again, in the creatinine, there was no significant proportional error between the 2 methods. So which are the benefits of using this service of having patients collecting a blood sample at home? We get, for the first time, we can get 12-hour trough levels, or we, as clinicians with interest in transplantation, we know that doing that in a busy clinic is really, really difficult because patients take the tablets in different times. To achieve the 12-hour trough levels in the hospital is not a realistic perspective. So for the first time, we get accurate 12-hour trough levels. We get reliable results at home. We keep our patients safe. They don't need to waste time. They don't need to take time off of their work or of their other activities. So we do save time for them. We save costs for them. So that's really important. I need to mention a couple of things. One, that the sample is stable for almost 14 days. And when they use this service, they don't have to go to a post office or use any particular pack. They just send it using the regular mailbox. So someone can be even in vacations, they can hike in Scotland, and in the morning they can send us the sample. For the time being, we have validated the sample for creatinine and tacrolimus, and I'll speak a little bit about the limitations of the test in a few slides. Another benefit that we haven't realized in the beginning is that it promotes patients' engagement. So we do have patients now that are actively involved in their care. They ask about their levels, they ask about the target levels, they know what creatinine means. So it did make a huge difference in some group of patients. As I mentioned previously, it led to significant cost savings. All the big transplant centers, they have a huge catchment area. So we had patients traveling from Brighton, from Portsmouth, miles away, hours away. So now we're saving money from hospital transport. We increase our capacity of the clinic, and also we do fewer blood tests. In patients, as we know, in renal patients who have really difficult veins, we do help with vein preservation. It's an environmental friendly choice, and also it expands access and equality, particularly in patients who are not very close to the main centers. In addition, I think it's really important to realize that it saves patients from a burnout, because sometimes by asking patients to come back all the time for repeat creatinines or after changes of the tacrolimus dose, it leads to very frequent visits, which has a negative impact on the mental health of our patients and on their quality of life. What are the main issues? By using this particular device, in some other devices, the results are slightly better, but initially we had up to 10% of the sample being rejected. Over time, with training of the patients and with patients gaining experience, only 3 to 5% of the samples need to be repeated. Sometimes they're underfilled, sometimes they're overfilled. So a new device also gives you a result right away in regards with the quality of the sample. So we do avoid the burden of sending a sample that actually is not good enough. The main limitation of this method is that it uses hemolyzed blood sample. So it limits the spectrum of the test that can be done in this way. We've explored different options as well. So in our trust, also using micro blood tubes for collection of liquid blood. The limitation of that is that you can request maximum one test, very difficult to go for a second test. So what now we're doing is that we use the micro device for the creatinine and the tacrolimus, which is currently the validated test, and we use the micro tube for having a result about a full blood count hemoglobin. So going back to that, unfortunately, by using this method, we're not able to check for potassium, we're not able to check for liver enzymes, but gradually we're trying to validate other tests as well. What about the feedback? Of note, the whole project was designed with an active contribution of our patients. So the feedback was excellent. A few of the patients expressed some concerns whether this would lead to a total replace of the face-to-face visits by telephone visits and using these devices. But for the time being, we use this service mostly for very stable patients. We use it in every other visit, and also we use it after making changes in the tacrolimus dose, or if we worry about the result of the creatinine. The feedback from other clinicians and from my colleagues was excellent. We've been a finalist in the BMJ Awards. We had an award last year in the BTS. And also now we actively support our colleagues in different trusts in order to set a similar service. What are the future developments? We try to validate other tests, including drug levels and also HbA1c, so we can monitor patients after an SPK. We're already using that in different groups of patients. For example, in patients with glomerular disease who are on immunosuppression. And also we use it for, as I mentioned in the beginning, with other tests at home. So we use a urine test that can be done at home, and with the use of a smartphone, very straightforward, can get a reliable result about not only about the whole urine dipstick, but also about ACR. So for example, a patient with membranous disease or with minimal change, not only they can check the tacrolimus level at home, they can actually monitor the proteinuria at home. Overall, I think this is the future, and I see that in a few years, quite a few things will be done at home. So the visits, I think, will be less frequent. This service offers reliable data, reduce hospital visits, keep patients safe. It was a major thing during the pandemic to keep patients at home, but even after the pandemic, it saves significant time for our patients who have better things to do than come so frequent to the hospital for blood tests, particularly for tests that can be done at home. It also empowers and activates the patients. It promotes active engagement, which I think it's a big bonus. As I mentioned before, reduces costs both to the patients because they have to spend less for transport, and also to NHS, given that we save money from the hospital transport. And also it's an environmentally friendly choice. So overall, I think home monitoring service for our transport recipient has been an innovation that it did make a difference. And I can see that in the future it will be developed even more. There's a big team behind this service, and I would like to thank the team from different areas, from the lab, from the managers, and so on. I would like to thank you for attending this presentation. Please drop me an email, keep in touch if you would like to learn more about the service, and if you would like to share your experience. I'm sure people do different things in different centers, so we would love to learn from the others, and we're more than happy to share our experience. Thank you very much.